In early 2020, the SARS-CoV-2 virus hit the human population with a massive mortality shock. Within 2 years, officially recorded global fatalities crossed 5 million, triggering a frantic rush to triage acute respiratory collapse and system failure in intensive care units around the world. But this chart shows a startling demographic clustering beneath those massive top-line numbers. If you look at the median age for COVID-19 fatalities, it sits at 74. And the age-adjusted Charleston Comorbidity Index, a validated medical tool used to predict mortality based on severe underlying conditions like diabetes and hypertension, registers a high score of 5 for severe COVID patients. The data revealed a highly targeted biological vulnerability, yet the policy response applied to everyone. Global institutions implemented universal, indiscriminate movement restrictions on the entire population, regardless of individual risk profiles. This disconnect normalized a new precedent, the suspension of individual risk assessment in favor of collective, algorithmic management. By treating a specific clinical threat with a universal blunt force mandate, governments successfully operationalized a permanent framework for societal control. To enforce those physical boundaries, governments rapidly repurposed foundational identification systems. Citizens were suddenly required to mathematically prove their medical status via cryptographic QR codes just to access basic public spaces or associate with others. As the pandemic faded, those emergency tools did not disappear. By 2026, the European Union legally mandated the European Digital Identity Wallet, seamlessly transitioning a temporary public health pass into a permanent civic requirement. Now, regulated private sector industries, including banking, telecommunications, and healthcare providers, are legally obligated to integrate this digital identity layer to function. You need the digital token to open an account, access your phone network, or sign cross-border contracts. The technological architecture for algorithmic movement control is fully established. It is now completely decoupled from any active pathogen, sitting dormant in our pockets, ready for any future legislative trigger to activate sweeping societal restrictions. The physical restrictions eventually gave way to chemical compliance. Under the banner of no jab, no job, governments and corporations tied an individual's economic survival to a mandatory medical intervention. This effectively overrode traditional medical ethics and the principle of informed consent, subjugating personal bodily agency to state enforcement. The primary scientific justification for these heavy-handed mandates was that universal vaccination would stop community transmission. But as the virus mutated rapidly through the emergent Delta and Omicron lineages, that premise proved biologically false. Premier health agencies were forced to quietly rewrite their public guidance, conceding the interventions could not prevent infection or spread. As the acute crisis cooled, longitudinal safety monitoring exposed severe, previously obfuscated data. This chart illustrates the findings of a rigorous independent audit of the original mRNA clinical trials. It reveals an absolute excess risk of 1 in 800 vaccinated individuals suffering a severe, life-altering adverse event compared to the placebo baseline. Compare that 1 in 800 harm rate against the astronomical number needed to vaccinate. To prevent a single severe hospitalization in healthy demographics, aged 30 to 39, you had to dose over 318,400 people. Applying a high-risk intervention across a low-risk population guaranteed a massive accrual of harm. Independent molecular biology research has since clarified the mechanisms behind this iatrogenic damage. Proteomic profiling of post-market white clots revealed they are composed of hyperdense fibrin fibers with a near-total absence of plasminogen, the enzyme the body uses to dissolve clots. Simultaneously, studies demonstrated that the synthetic spike protein physically blocks the p53 tumor suppressor protein from interacting with its regulators, functionally paralyzing the cell's ability to repair DNA or induce death in cancerous cells. Enforcing a biologically risky intervention upon a demographic that faced almost negligible threat from the virus itself did measurable damage to public health. More critically, it destroyed the institutional credibility of global regulatory agencies. That collapse of trust at the biological level triggered a massive geopolitical rebellion. Fearing supranational overreach, member states pushed back heavily during the drafting of the 2025 pandemic agreement. explicitly blocking the World Health Organization from acquiring legally binding powers to mandate lockdowns, border closures, or vaccines globally. But the political damage proved too deep to repair. In January 2026, driven by a crippling $38 trillion domestic sovereign debt crisis and internal UN corruption scandals, the United States formally finalized its total withdrawal from the WHO. The U.S. exit triggered an immediate existential crisis. The organization faced a catastrophic $2.5 billion budget gap, forcing the planned termination of roughly 25% of its workforce by mid-2026, and severely degrading disease surveillance networks in critical endemic zones. To survive the financial shock, the WHO became heavily reliant on the shadow influence of private philanthropies. Entities like the Gates Foundation utilized earmarked voluntary contributions, funds strictly restricted to specific high-tech vaccine initiatives, to absorb the funding void, effectively dictating the operational priorities of the global health architecture. The global health apparatus no longer operates as a democratic coalition of sovereign nations. It is a highly fragile, privatized entity, heavily captured by corporate and philanthropic monopolies. The fragility of this new geopolitical reality was tested almost immediately. In May 2026, the WHO was notified of a cluster of severe respiratory illness aboard the MV Hondias cruise ship. The pathogen was identified as the Andes virus, a highly lethal strain of hantavirus entirely unique in its capacity for human-to-human transmission. News of a lethal respiratory virus spreading in a closed environment instantly triggered societal flashbacks. Social media platforms were instantly flooded with anxieties over impending global lockdowns and fears of a manufactured plandemic 2.0. But public health authorities entirely avoided sweeping global closures this time. Instead, the response relied on precision medical evacuations, rigorous international contact tracing, and strict 42-day biocontainment quarantines for exposed passengers. While the containment was successful, the operation exposed the hidden cost of America's new aggressive bilateralism. By withdrawing from the WHO, the U.S. severed its integration with global intelligence sharing networks, effectively blinding American health security to the real-time genomic evolution of pathogens in the developing world. Targeted containment prevented a localized spillover from becoming a global catastrophe, but the deep geopolitical fractures have left the world dangerously uncoordinated, lacking a unified early warning system in the face of novel biological threats. In the wake of the outbreak, conspiracy theories swirled that pharmaceutical companies had advanced knowledge, pointing to pre-existing research on an mRNA hantavirus vaccine. But the reality is far less orchestrated. The translation from preclinical success to human trials had actually been stalled for over a year, strictly due to a lack of emergency manufacturing funding. The temporary lockdowns of 2020 left behind a permanent digital surveillance architecture and a medical establishment governed by commercial rather than clinical imperatives. Society survived the virus, but in the relentless pursuit of universal biosecurity, we sacrificed fundamental human sovereignty, and we shattered the bedrock of public trust required to weather the next inevitable storm. If you want to understand how these global mechanisms actually work and uncover the realities hidden in plain sight, subscribe to the channel and join us for the next deep dive.